My work is concerned with nutrition, which may be seen as a link between health and agriculture and food. Working in nutrition is already quite a challenge because sometimes it's not recognized as an important determinant of health. I'm also working on a difficult topic in Africa with, of course, partners in Africa. That is the double burden of malnutrition, the coexistence in communities of undernutrition, malnutrition, vitamin A deficiency, and others, and conjunction with chronic disease risk factors, that is obesity, but also diabetes, cardiovascular disease, hypertension. So we observe now more and more the dual presence of these problems, which are sometimes considered as opposite problems, but they're not really. The difficulty is that obesity is perceived in a very positive way, so it's difficult to fight against it. Also, food systems need to be rehabilitated, local food systems. There's also the problem of maternal and child undernutrition, which further increases the risk of chronic diseases later on in life, like obesity, hypertension, diabetes. It's a complex problem, so the solutions are also complex. But what we are trying to apply as strategies is a three-pronged strategy. That is training people, because better trained people, better informed people is crucial and it's sustainable. Secondly, we're trying to intervene, for instance, in schools for prevention through better food choices, also influencing families and communities. And we're also, in a third strategy, trying to influence not only the population, but also decision makers, so that they implement policies and programs to address this double burden of malnutrition through the agriculture sector, through the health sector, or through communication. This is my first time attending the Geneva Health Forum, and I was quite impressed not only at the perfect organization, but also at its innovative aspects, with much more participation on the part of attendants. So we didn't have only conferences, we had interactive sessions. So innovation is perhaps the key message. Innovation in conferences, innovation also in health approaches, like using the telephone, the mobile telephones, like using distance programs.